Hello, I'm Dr. Abhishek. I'm consultant dermatologist of Wisdom Skincare Clinic. I'm also the associate editor of Indian Journal of Dermatology. Hello, today we are going to talk about eczema management. Now, as you have already mentioned that eczema can be of lot of types, eczema can have lot of presentations, and you need a specialist opinion for diagnosing a cause of eczema. There are a lot of eczema which doesn't require any test for diagnosis. It's just a clinical eye of a good quality dermatologist which picks up an eczema. But however, in certain condition we need some test, like one condition called contact dermatitis, where people have allergy to certain chemicals, which can be your occupational allergens, like you work in a factory where there can be some chemicals which leads to some kind of problems, or you work with cements, the cement people can develop eczema to that, and also is something your habit, like you use a hair color, that can cause eczema. So we have this testing called patch testing, which has a standard battery of common allergens, and it can be done very easily in a good quality dermatological clinic. And if you do that, then we can sometimes pick up the exact cause of your eczema, exact cause of your contact dermatitis, and that can help you and the dermatologist to treat it better. Now, what could be the treatment? The most important treatment of eczema is basically using a lot of moisturizer. Moisturizer is very good for eczema prone patients. If you apply good quality moisturizer and a good amount of moisturizer, half of your problem is already solved. The problem, a lot of people do not use moisturizer properly. One important rule about moisturizer is 3 minutes rule. That means moisturizer has to be applied on wet skin just after bath, within 3 minutes after bath. So then only your moisturizer works your best, and it cannot work in dry skin. Second part of the story is, a lot of people use moisturizer, very fancy moisturizer, but they do not apply that in a good amount. You have to remember, in adult patients, for a week you have to use at least 250 milliliter of moisturizer. That's a huge lot of moisturizer on your body. People ask me whether I can use oils instead of moisturizer. I said yes, you can use a virgin coconut oil instead of moisturizer. That is a very good quality moisturizer. However, it doesn't stay in your body for a long period of time. So if you using coconut oil as a moisturizer, then you have to use multiple times more frequently. For moisturizer, if you use twice, it should be good and sufficient. For oil, it may have to use 4 to 5 times in a day. However, oil or moisturizer, if you put good amount, much of your symptoms will be less, and your drugs will be much less required. Then what could be a treatment? Doctors see your skin condition and decide on the type of drugs they want to give. Sometimes they can give some oral drugs, but most often doctor treat the skin condition with some topical ointments. Many a times it can be a steroids, which is very important treatment for eczema. However, you should not take over-the-counter steroids and apply on your skin, because it can be detrimental. So before using a steroid or before using a cream for eczema, you should always consult a dermatologist and then take a required amount of treatment. At times, doctors also give some antihistamines which can decrease your itchy sensation, especially at night. With this simple bit of treatment, and if you use a soft soaps, if you daily use regular moisturizer, your eczema most often can be treated very nicely. Hope this video has helped you. If you want to know further, if you want to contact us, please click the link below.